Hey everybody, happy Thursday. I hope everybody is doing fantastic. It is almost the weekend, so just hold on a little bit longer. We're almost there. But anyways, we are starting kind of like a new series. We spent the last few months building up your foundation of some key foundational information to help you as you transition into anesthesia school. And now I want to start talking about kind of the foundational info that you need to know as you start clinicals as a brand new SRNA. So we are going to start off by talking about ventilator stuff because I feel like that's super tricky. So I have some questions that you guys have asked me that I've kept tabs up with, and I'll be answering those over the next couple of weeks as we'll be kind of focusing on kind of vent stuff, respiratory stuff. Okay, sound good? So today we are going to talk about pressure volume loops, not to be confused with flow volume loops. You will learn about the flow volume loops later on if you haven't already. And that's going to be talking about obstructive, restrictive diseases. You'll hear him talk about biting off an ice cream cone top, stuff like that. Yeah. So we're not going to talk about that today. We are going to talk about pressure volume loops, PV loops, as far as mechanical ventilation and the ventilator goes. So remember, when we are breathing, when we are ventilating patients, it's all about flow, it's all about volume, it's all about pressure, compliance, and resistance, okay? Those are all the major players that you have to understand, the key pieces to understand how to properly ventilate and take care of your patients. Now, the definition of compliance is change in volume over change in pressure, all right? So essentially, if we're looking at pressure and volume loops, we're talking about compliance, we're looking at a patient's lung compliance, okay, within the system. Now, when our compliance is optimal, when we are doing the best thing for our patients, when we're mechanically ventilating them, we have proper VQ matching. Let's see, I'm trying to think what else. Oh, we get good alveolar recruitment, and we prevent lung injury, and we are doing this all with ideal pressures, okay? So that's all of the good things that happens when our lungs are nice and compliant and everything is working correctly, okay? So I hope you can see this. I didn't do a PowerPoint, I did a little drawing today, so that's what we're gonna kind of focus on. So this is essentially your pressure volume loop, which is a breath, okay? So this schematic represents a breath. Now, really quick, when patients are spontaneously ventilating, this actually goes clockwise, okay? Clockwise. But because we are going to talk about positive pressure or mechanical ventilation, this actually goes counterclockwise, okay? So let's look at all the pieces of the pressure volume loop, and then I will talk about a couple things that you can use to apply. All right. So PEEP, we all start here. Well, first of all, you have your pressure is here and your volume is here. Okay. And everything starts with PEEP. So PEEP is the very start of inspiration. Everything is opening up, right? Those alveoli are opening up. They're exchanging. We've got, this is the lip or the lower inflection point. This is when compliance is at its best, right? These are when the lungs are opening. We have a lot of volume going on here at a low pressure. Breath is going in, right? We are positive pressure. We are putting a breath, an inspiration into our patient, okay? So when we get all the way to the top here, that becomes our peak inspiratory pressure and our tidal volume, okay? So that's what that peak is. Then we get this upper inflection point right here, and that is as we are as we are exhaling or expiring, right? Pressure is going down. All right, all the way back down, and that is essentially what is happening in one breath, okay? Easy peasy. Now, I want to talk really quickly about volume control versus pressure control, okay? Now, when you have your vent setting to volume control, you are delivering a tidal volume at variable pressures, okay? You are setting the volume, you are setting the rate, and your pressures tend to go up and down, okay? And remember, this is kind of inspiration. This is when we're going to see a lot of changes in those pressures right here to get up to our peak inspiratory pressure, okay? So this is going to be variable with volume control. Now, when you have a patient in pressure control, the pressure is actually constant. You have a constant pressure during this inspiration phase, and it changes the look of this loop. So this inspiration phase is actually a little bit more, I guess to say kind of flattened, because the pressure is constant here. The pressure is not changing. So what that means is when you are in a pressure control mode, you cannot really assess compliance. Okay. We're going to pretend this is volume control right here. When you're in a volume control mode and this pressure is variable, that's when you can actually assess the patient's compliance. Okay. So I just want to make that clear. So when we're looking at pressure control loops on our machine, and I actually have a little video of one I'm going to put on Facebook, maybe Instagram, I'll put it somewhere. Now, if this turns into a duckbill, so imagine this point, I kind of drew it out here, but imagine this point kind of comes off into like a beak or a duckbill. That's actually telling you that you've got an increased peak inspiratory pressure, which could mean you have some overdistension going on, all right? So the best thing to do here, because you're at risk for barotrauma if you're overdistending the lungs, so I would probably drop your tidal volumes, right? Because putting in more tidal volumes and overdistending the lungs is not going to help you do anything good for your patient, okay? So look for a little duckbill here, drop your tidal volumes if you see that. And now pretend this is perfectly in the center. Okay. So I drew this, perfectly in the center. Now, if this curve would be shifted to the right in volume control mode, that would show that you've got a decreased compliance. Okay. So what are some things that are decreased compliance in the lungs? ARDS, you lose compliance. Any type of pleural effusions. If the patient is atelectatic for whatever reason, pulmonary edema, pneumothorax. Okay. So if this whole thing shifts over to the right, you're going to be looking at problems with decreased compliance, okay? Now, if this whole thing would be shifted over here to the left, you would be looking at increased compliance, and that would be like your emphysema or your COPD, okay? So, it's really quick, pressure volume loops, not flow volume loops, all right? If you have any questions, let me know, and I'm gonna put a little video of a ventilator, kind of what that actually looks like in live real time. But that is how you can use your pressure volume loops, and that is the breakdown of it. And look for more awesome stuff coming up in the next weeks, okay? Happy Thursday. Love you guys. Have an awesome day. I'll talk to you soon.